Hi, my name is Heidi Kodra. I am a registered nurse, also a student of the University of the South Wales. Today, we will be speaking about macrovascular complications in type 2 diabetes. According to studies, it is proven that high levels of blood glucose in patients with diabetes puts them at risk for developing cardiovascular conditions. Looking at studies such as the UK prospective diabetes study, it shows clear evidence that high A1C levels puts patients at risk for developing myocardial infarction and microvascular diseases. Therefore, it is clear that hyperglycemia, or as we say, high blood glucose, puts you at risk. It's basically a risk factor in patients with diabetes. A blood glucose reading of 5.60 mmol and higher increases patients with diabetes type 2, their risk for developing cardiovascular conditions. According to the Heart Outcomes Prevention Evaluation, every fasting glucose that is increased by 1 mmol increases your chance for developing a stroke or cardiovascular death and myocardial infarction by 9% in 4.5 years. However, other risk factors need to be taken into consideration, such as age, blood pressure, sex, and high levels of lipids. Macrovascular complications in patients with diabetes. The complications basically affects three main organs in the body: the brain, the heart, and the large blood vessels. PAD, or peripheral artery disease. Normally, the peripheral arteries are smooth and free for blood flow. These arteries carry nutrients, oxygen, and glucose to all parts of the body, including the legs. Normally, with age, these arteries become narrow, and because of plaque buildup over time, that plaque causes the arteries to become stiff, therefore limiting the blood flow in the legs and toes. There is a condition I'm pretty sure that many of you know about, atherosclerosis. When the blood glucose is not controlled in patients with diabetes, it increases the low-density lipoprotein, or as we say, the bad cholesterol, and brings down the high-density lipoprotein, which, as we know, is the good cholesterol. The function of the arteries, as we said earlier, carry the oxygenated blood to parts of the body, especially the heart. Plaque is built up in the arteries when calcium, fat, cholesterol, and other elements in the blood come together. When that happens, the arteries get narrow and narrower as the plaque builds up and hardens. This results in blood flow to the organs and other parts of the body to be decreased. Atherosclerosis is a very serious condition, and it can be prevented. Without controlling, especially your LDL levels, this can lead to a stroke, heart attack, or even death. Now, let's look at risk factors for developing atherosclerosis. High blood pressure. If you are a diabetic, especially with a high blood pressure, you would like your blood pressure to remain in the range of 140/90 and no higher. Smoking. Smoking can increase blood pressure, raise cholesterol levels, and can tighten and destroy blood vessels. As a result, the body's tissues are deprived from oxygen. Physical inactivity. When a person, especially with diabetes, is not physically active, cholesterol levels can increase, and weight along with the blood sugar. Insulin resistance. A patient with diabetes, their bodies are unable to use the insulin properly. Insulin is a hormone which is used to break down sugars so that it can enter the blood cells to be used as energy. Unhealthy eating. Consuming foods high in fats, such as processed foods, fried foods, Especially trans fat, which is bad and dangerous, increases your risk for developing atherosclerosis. Family history. Having a family history of heart disease. Age. As you get older, your chance for developing atherosclerosis increases. Enough plaque will build up over time due to the years of lifestyle, genes, and finally, the symptoms will present. In men who are over the age of 45 and women over the age of 55 are at risk. Excess weight. Being obese or overweight can increase your risk or your chance for developing atherosclerosis. Taking control of your weight by exercising and eating healthy can go a very, very long way. Controlling your blood sugar. Blood glucose is a risk factor in cardiovascular conditions. Therefore, good glucose control of 6.5 mmol or lower would be very good if you want to look at controlling your blood glucose. Following your prescribed medication, keeping to your prescribed medication, and also eating healthy. Dyslipidemia. Dyslipidemia, as we know, is the low or the bad cholesterol which accumulates as fat along the arteries. If you have cholesterol and you take medications such as atorvastatin or simvastatin, that can help bring down the blood glucose. Again, as we said, also eating properly. Exercise will benefit in bringing not only your blood pressure, but your blood glucose down. Exercise is important in preventing macrovascular complications in diabetes. It will not, again, only benefit your blood glucose, but it's vital because it enables you to keep a good and healthy weight. Patients with diabetes are at risk for developing cardiovascular conditions. It is important that you, as a diabetic, control your blood glucose by 1. Eating healthy, 2. Exercising, and taking your prescribed medications. Yes, we understand that diabetes is very complicated. Hence, preventing complications improves your quality of life and enables you to live a fuller and happier life. Thank you very much. I hope you did enjoy this presentation.